He will be pleased to know that some counties, like Essex, but also Norfolk, are showing significant success. But as I say, there is still a lot more to do to overcome this very pernicious and particularly unpleasant business model, which focuses on exploiting young and vulnerable people as part of its way of making money. But I can assure him that we will not stint over the coming years in trying to eradicate it from our country.
Thank you, Mr. Speaker. Too many people die in open water because of lack of life-saving equipment. In May this year, my constituent 16-year-old Sam Haycock drowned in a nearby lake. His friends tried to save his life, but were unable to access the lifebelt because it was padlocked and they couldn't get it unlocked in time. This was done to prevent vandalism. The 1971 Criminal Damage Act contains no specific offence for the damage or destruction of life-saving equipment, so the deterrents are not in place to prevent vandalism. Does the Minister therefore agree that it is vital that appropriate and specific penalties are in place to save and protect the equipment that could have saved Sam's life?
Secretary Butler.
Well, the Honourable Lady raises a case that I think shocks and concerns us all, and I would be more than happy to talk to her directly about these issues. As she knows, the law of criminal damage is being reformed in other respects in the current bill, but I want to make sure that we reflect the often devastating consequences of thoughtless and criminal acts of damage against vital pieces of life-saving equipment such as the one she raised.
Mark Palsey.
Thank you, Mr. Speaker. My constituent is involved in a case where controlling and coercive behaviour is alleged, and the case has been delayed due both to COVID and a number of failures within the court process. The consequence of delays means she continues to have to interact with her ex-partner when arranging contact over matters such as arranging contact with their children, in the process causing her great distress. So what steps is the Department taking to ensure that victims of domestic abuse are able to have their cases heard in a timely manner?
Minister.
Thank you, Mr. Speaker. Well, I'm extremely sorry to hear the experience my honourable friend's constituents has undergone. And I can confirm that court recovery from COVID in this area is a priority. For example, domestic violence protection orders are being prioritised, and I know that in cases where there is a particular vulnerability, the judiciary, in deciding which cases to list, do give that very careful consideration. As I laid out in answer to the very first question, significant additional resources have gone into the justice system, which have resulted in higher levels of public family law disposals, very significantly higher this year than last year. We're using remote hearing technology, getting extra sitting days organised for exactly the reasons my honourable friend mentioned, and hearing cases, awful cases, like the one he described, remains a significant priority.
Thank you, Mr. Speaker. Back to female Afghan judges. The key question is, what steps has his department taken to allow safe passage out of Afghanistan for the female judges? And what time frame are they working to? Because when they think it will be too late because executions begin?
Well, as I said to the House earlier, Mr. Speaker, the Arab scheme, of course, covered the initial flights out. We have now extended and created a new scheme yesterday, which will cover and make as a priority those particular judges. He knows that the issues in country are complex, that colleagues across government are working out ways in which we can facilitate safe passage, but I can assure him that everybody who fits that category will get the warmest of welcomes in this country, and the work goes on daily. I don't know how many times I can explain this, Mr. Speaker. There is a clear plan, and we're getting on with it.
Rob Butler.
Thank you, Mr. Speaker. Prison officers and staff have done an amazing, excellent job keeping prisoners safe during the pandemic, with much lower infection rates in jails than had been feared. That has mainly been achieved by keeping prisoners locked in their cells, but we now obviously need to move beyond that so they can access education, work and other rehabilitation programmes. So can my right honourable friend tell the House what progress is made rolling out vaccines in prisons, which would allow this vital work to resume?
Well, I'm very grateful to the honourable gentleman. He's absolutely right to pay tribute. Shall I tell him why? At the beginning of this pandemic, there was a prediction that 2,700 prisoners would die in English jails. In fact, it's under 130. And although every one of those is a tragedy, it is a powerful tribute to the work that they did. He makes a very important point about vaccination. Every prisoner has been offered a vaccination. There are some decline rates, higher in London, up to 50%, and every effort is being made to encourage prisoners to do that, because we can then open up the regime.
Thank you very much, Mr. Speaker. Work cuts reoffending rates in half. the recruitment junction in my constituency has a 50% success rate getting ex-offenders into work. That is twice the national average. They tell me the biggest challenge is housing, such as for Stuart, also my constituent, who is released after 30 years in prison, provided with just 8 weeks accommodation. If he doesn't find somewhere to live by tomorrow, he will be recalled into prison at huge cost to himself and to the taxpayer. How is the Minister going to help Stuart get somewhere to live by tomorrow?
Minister.
Well, the Honourable Member makes a really important point, because if we want to cut crime, we absolutely have to reduce reoffending, and that means that we have to get people who come out of prison a job, they need to get a home, and they need to, if they're on drugs, get off drugs. And that's absolutely what we're doing. And in July, we launched our £20 million scheme to provide temporary accommodation for prison leavers at risk of homelessness in 5 probation regions. And on the work coaches, we are also working very closely with the DWP to ensure that we have work coaches in prison to get people jobs.
Bon Bailey.
Thank you, Mr. Speaker. Last year, the Expert Family Solutions Group produced a hard-hitting report called What About Me? And this focuses on the 280,000 children each year that experience their parents separating. With the Divorce Act fast approaching and family courts increasingly stretched, will my right honourable friend meet with me to discuss ideas and some of the report's identification of policy gaps for separating families?
Well, I'm grateful to my honourable friend who has considerable professional experience as a family lawyer of distinction, and I will be more than happy to speak to her. That report sounds as if it complements the family harms report published earlier this year, and the excellent work being done by senior judiciary in the family division to minimise the fight when it comes to the future of our children.
Thank you. The Law Commission is currently doing an important review into intimate image abuse, which I hope will recommend making it an offence to take photographs of breastfeeding without consent. Can the Secretary of State indicate when he expects the report to be published? And perhaps more importantly, what assurance can he give that the recommendations of the report will be given timely, swift consideration and action?
Secretary Butland.
I'm grateful to the Honourable Member for raising the Law Commission report. I will write to him to clarify the date by which the Law Commission will publish. It's clearly important work. There's a shared will across the House to take action wherever appropriate, and he can be rest assured that this government will not slack when it comes to protecting women and other vulnerable people.
I know you'll be very exercised by the Public Service Pensions and Judicial Offices Bill, which is currently going through the other place, particularly Clause 103, which is going to raise the retirement age of magistrates from 70 to 75, thus fulfilling the ambition of my private member's bill in the last session. But whilst we wait for that legislation to go through, what other measures is my right honourable friend taking to get through the backlog of cases in our courts, particularly having online cases?
I'm very grateful to my right honourable friend, who of course himself was a practitioner of many years standing. He can be assured that we are using every tool in the book, through remote hearings, through the bringing back of judges who have recently been retired, and indeed the harnessing of the entire legal profession to deal with the number of cases before the courts. The restriction on sitting days has been lifted, and I know that colleagues in Her Majesty's Courts and Tribunal Service are working tirelessly to deal with the caseload.
Thank you very much, Mr. Speaker. Can I return to the case of the female Afghan judges, which I raised with his Home Office colleague yesterday? A former female Afghan judge who escaped 2 assassination attempts by the Taliban and who is now a British citizen contacted me at the weekend to explain to me the very real and immediate danger that her colleagues are in, particularly from dangerous criminals and terrorists who have been released from prison. Now, I'm bringing her into Parliament at 5 p.m. this evening to meet informally with the Justice Select Committee. Could the Lord Chancellor, or perhaps one of his junior colleagues, come to that meeting and meet with this lady to hear at first hand how desperate the situation really is?
Well, of course, Mr. Speaker, I will make sure that my diary is adjusted to do that. She can be rest assured I'm getting emails from her colleagues directly to my parliamentary account as well. These are harrowing tales, harrowing experiences, which is why I meant what I said in my answers earlier. I'm very grateful to the Honourable and Learned Lady.
Is the point of order relating to the questions we just had? Point of order, David.
Mr. Speaker, the whole House has expressed tremendous concern at questions about the situation facing Afghan judges. In response to my question earlier, the Secretary of State said that he hasn't written to me once about judges in Afghanistan in reference to myself in my role as Shadow Justice Secretary. I just asked the Secretary of State, with all graciousness, to correct the record. I wrote to him on the 16th of August. I've got the letter in front of me and it's available online. And he replied to me on the 25th of August. So I would ask him just to correct the record.
Secretary Butler.
Well, Mr. Speaker, I'm happy to do that. And can I remind the right honourable gentleman, and of course apologise to him, that I'm more than happy to speak directly to him. He will know that the urgency of this situation means that phone calls, texts are absolutely acceptable, and I'll be more than happy to do that with him. This has been, as Mr. Speaker, you know, a very busy time, and I hope that the House will forgive me if on this occasion I got it wrong, and I do apologise to him.
That's good to see. Harmony has broken out. Right, let us come to the statement. We now come to Secretary of State for Health, Sajid Javid.
Yeah.
Secretary of State.
Mr. Speaker, before I make my statement today, I'm sure the whole House will want to join me in offering our condolences to my right honourable friend, the Prime Minister, and my noble friend, the Baron Johnson of Marylebone, on the loss of their mother, who sadly passed away yesterday. Our thoughts are with them and their whole family at this most difficult of times. Mr. Speaker, with permission, I'd like to make a statement on the pandemic and our autumn and winter plan to manage the risk of COVID-19. Over the past few months, we've been making progress down the road to recovery, carefully and cautiously moving closer to normal life. And as we do this, we've been working hard to strengthen our defences against this deadly virus. We've been continuing the rollout of our vaccination programme, with 81% of people over the age of 16 having had the protection of both doses. We've expanded our testing capacity yet further, opening a new mega lab in Leamington Spa. And we've continued supporting research into long COVID, taking our total investment to £50 million. Thanks to this determined effort, we've made some major steps forward. The link between cases, hospitalisations and deaths has weakened significantly since the start of the pandemic, and deaths from COVID-19 have been mercifully low compared to previous waves. But we must be vigilant, as autumn and winter are favourable conditions for COVID-19 and other seasonal viruses. Children have returned to school. More and more people are returning to work. The changing weather means that there will be more people perhaps spending time indoors, and there's likely to be a lot of non-COVID demand on the NHS, including flu and norovirus. Today, keeping our commitment to this House, I'd like to provide an update on our review of preparedness for autumn and winter. The plan shows how we'll give this nation the best possible chance of living with COVID without the need for stringent social and economic restrictions. There are 5 pillars to this plan, Mr. Speaker. First, further strengthening our pharmaceutical defences like vaccines. The latest statistics from the ONS show that almost 99% of COVID-19 deaths in the first half of this year were people who had not received both doses of a COVID-19 vaccine. This shows the importance of our vaccination programme, and by extending this programme further, we can protect even more people. Almost 6 million people over the age of 16 remain unvaccinated in the UK, and the more people that are unvaccinated, the larger the holes in our collective defences. So we'll renew our efforts to maximise uptake amongst those that are eligible but have not yet, for whatever reason, taken up the offer. Next, we've been planning our booster doses too. Like with many other vaccines, there's evidence that the protection offered by COVID-19 vaccine reduces over time, particularly older people who are at greater risk. And so booster doses are an important way of keeping the virus under control for the long term. This morning, we published the JCVI's advice on a booster programme. They recommended that people who were vaccinated in phase 1, that is priority groups 1 to 9, should be offered a booster vaccine. That this vaccine should be offered no earlier than 6 months after the completion of the primary vaccine course, and that, as far as possible, the booster programme should be deployed in the same order as phase 1. I can confirm that I have accepted the JCVI's advice and that the NHS is preparing to offer booster doses from next week. The NHS will contact people at the right time, and nobody needs to come forward at this point. This booster programme, it will protect the most vulnerable through the winter months and strengthen our wall of defence even further. As well as this, we'll be extending the offer of a COVID-19 vaccine to even more people, as the Minister for COVID-19 vaccine deployment announced yesterday in the House, and thank you, Mr. Speaker, for allowing him to make that statement yesterday. All young people aged 16 to 17 in England have already been offered a dose of a COVID-19 vaccine to give them the protection as they return to school. And yesterday, the UK's chief medical officers unanimously recommended making a universal offer of a first dose of a vaccine to people aged between the ages of 12 and 15. The government has accepted this recommendation too, and will move with urgency to put this into action. We're also seeing great advances in the use of antivirals and therapeutics. Several COVID-19 treatments are already available through the NHS, and our antivirals task force is leading the search for breakthroughs in antivirals which have so much more potential to offer. Second, Mr. Speaker, testing, tracing and self-isolation have been another vital defence. Over the autumn and winter, PCR testing for those with COVID-19 symptoms and contacts of confirmed cases will continue to be available free of charge. Regular asymptomatic testing, which identifies currently around a quarter of all reported cases, will also continue in the coming months, with a focus on those who are not fully vaccinated, perhaps those in education or in other higher risk settings. And contact tracing will continue through the NHS test and trace system. We don't want people to face hardship as they carry out their duty to self-isolate. So for those that are still required to self-isolate, we'll keep offering practical and financial support to people who are eligible and need assistance, and we'll review these regulations and this support by the end of March 2022. Our third pillar, Mr. Speaker, is that we're supporting the NHS and social care. Last week, I announced a £5.4 billion injection for the NHS to support the COVID-19 response over the next 6 months, including £1 billion extra to tackle the elective backlog caused by COVID-19. We've also launched a consultation on protecting vulnerable patients by making COVID-19 and flu vaccinations a condition of deployment for frontline healthcare staff and wider social care workers in England. We're already making this a condition of deployment for people in CQC-registered adult care homes. And although we are keeping an open mind and we won't be making a final decision until we fully consider the results of the consultation, I believe that it is highly likely that frontline NHS staff and those working in wider social care settings will also have to be vaccinated to protect those that are around them, and that this will be an important step in protecting those at greatest risk. Fourth, Mr. Speaker, we'll keep encouraging people to take steps to keep seasonal illnesses at bay, including flu and COVID-19. The best step that we can all take is to get vaccinations for COVID-19 and flu if we're eligible. And so, along with our COVID-19 vaccination programme, the next few months will see the largest ever flu vaccination campaign this country has ever seen. Our plan also sets out a number of changes we can all make to our daily routines, like meeting outdoors where possible, or if you need to be indoors, trying to let in fresh air, wearing a face mask in crowded and enclosed spaces, where you can come into contact with people that you don't normally meet. And Mr. Speaker, Our fifth pillar is how we'll look beyond our shores and pursue an international approach. Last week, I attended the G20 Health Ministers meeting and I met counterparts from across the world. And I talked about the part that we'll be playing to lead the global effort to accelerate access to vaccines, to therapeutics and to diagnostics. And as we do this, we'll maintain our strong defences at the border, allowing us to identify and to respond to variants of concern. It's these defences and the progress of vaccination campaigns both here and abroad that have allowed us to manage the risks and to start carefully reopening international travel once again. We've already relaxed the rules for fully vaccinated travellers, and I asked the CMA to review the issue of exploitative behaviour in the private testing market. This review reported last week, and I'm looking into what further action we can take. And I can also update honourable members that on top of these measures, we'll be publishing a new framework for international travel, and my right honourable friend, the Transport Secretary, will be announcing more details ahead of the formal review point on the 1st of October. Thanks to the defensive we've built, we've been able to remove many of the regulations that have governed our daily lives, rules that were unprecedented yet necessary. And our plan shows how we'll be removing more of these powers while maintaining those that are essential for our response. This includes expiring more of the powers in the Coronavirus Act. So, for example, those powers directing to temporary closure of educational institutions. The remaining provisions will be those that are critical to the government's response to the pandemic. For example, making sure that the NHS is properly resourced and supporting statutory sick pay for those who are self-isolating. Mr. Speaker, the plan before the House today is our Plan a comprehensive plan to steer this country through the autumn and winter. But we've seen how quickly this virus can adapt and change. So we have prepared a Plan B of a contingency measures that we can call upon only if they are needed and supported by the data to prevent unsustainable pressure on the NHS. These measures would be communicating clearly and urgently to the public the need for caution, legally mandating face coverings in certain settings, and whilst we're not going ahead with mandatory vaccine-only COVID status certification now, we'll be holding that power in reserve. As well as these three steps, we'd consider a further measure of asking people to work from home if they can for a limited time if that is supported by the data. Any responsible government must prepare for all eventualities, and although these measures are not an outcome that anyone wants, it's one that we need to be ready for just in case. Mr. Speaker, ever since we published our roadmap to recovery 7 months ago, we've been carefully but cautiously getting this nation closer to normal life. Now we've come so far, we've achieved so much, we must stay vigilant as we approach this critical chapter so that we can protect the progress that we have all made together. I commend this statement to the House.
Shadow Secretary of State Jonathan Ashworth.
Grateful, Mr. Speaker, and I thank the Secretary of State for advance sight of his statement, and I, like the Secretary of State, want to extend my condolences to the Prime Minister and the wider Johnson family at this difficult time. Now, infection levels today are actually higher than they were at this time last year. So the test of his Plan A and his Plan B is whether we can push infections down, minimise sickness and save lives, keep schools open, protect care homes, maintain access to all care in the National Health Service, and avoid a winter lockdown. He's talked about a Plan B. Can he tell us what level of infection and hospitalisations does he think would trigger Plan B? Now, yesterday Downing Street briefed about a lockdown as last resort. What then, if I may put it like this, is first resort in combating the virus to avoid a winter lockdown? And will he rule out today local and regional lockdowns like we saw in my city of Leicester or in Bolton and parts of West Yorkshire last year? Now, on vaccination, last night we had confirmation of a vaccine programme for children. We welcome that and we support that. And he's now confirmed a booster jab as well. We again welcome that and support that. But how will he boost vaccines in those areas of the country where vaccine take-up remains relatively low. For example, Bradford, the second doses are running at around 65%, Wolverhampton 65%, Burnley 69%, my own city of Leicester 61%. What support will be made available for those areas and others so they can boost vaccine take-up? Vaccinating children is often justified, in my view wrongly, on the basis of its impact on adults and the wider transmission. But children and young people would actually benefit further if vaccination rates were increased amongst adults. But amongst younger adults, 25 to 30-year-olds, it's running at around 55% on a second dose. 30 to 35-year-olds, 68%. So what is he going to do to vaccinate more younger adults? What campaign is he going to run to get those vaccination rates up? And what is the plan for those who are immunosuppressed, who have shielded throughout this crisis? One example, there are 1 million cancer patients who can't produce an immune response to vaccines. Will they be offered prophylactic antibody treatment that are now available, or will they be expected to shield further throughout the winter? And on flu, he's right to raise flu and seasonal viruses, but he will know that the Australian flu season has been minimal. It's good for Australia, obviously, but that impacts the ability to collect samples to make an appropriate vaccine for the strain that might hit us. Is he confident of the effectiveness of the flu vaccine to match this year's strain? Now, secondly, on test and trace and wider diagnostics, again, flu, RSV, we're likely to see more common colds and coughs. These are viruses with overlapping symptoms to COVID. And there are also an increasing range of symptoms associated with COVID as well. Will he look at multiplex testing? So as well as diagnosing a COVID, whether you are COVID positive, it also diagnoses flu and RSV. The Academy of Medical Sciences have recommended this. And he said that PCR testing will continue free of charge through autumn and winter. I think that's the first time my time frame has been put on free PCR testing. Is he suggesting we'll be moving to a different system for PCR testing from next spring and summer, where perhaps people will be expected to pay for a test? Could he just clarify the government's thinking for testing next spring and summer and from the rest of the year? Now, of course, isolation rules have changed, understandably, but we still need tracing systems. So will the local authorities get the tracing, the resources they need to do contact tracing? And for those people who need to isolate still, will local authorities have more money in their funds to pay isolation payments? Because we know that people who are low paid on 0 hours contracts and so on, it's such a struggle for them to isolate themselves. He's talked about mask wearing and working from home, but he's not talked about ventilation so much, because we know the virus is airborne. We know that workplaces actually have legal standards about the quantity of fresh air and purified air that is appropriate. So what is he going to do to drive up ventilation in workplaces and support public buildings to install the relevant kits, air purification kits, so people are not breathing in contaminated air effectively? He didn't mention social care. One of the most devastating consequences of failing to protect care homes, of not putting that protective ring around them, was the tragic number of deaths in care homes. The Infection Control Fund currently ends at the 30th of September. Will that Infection Control Fund for social care be extended? And finally, on vaccine passports, can he just clarify what exactly is the position of the government now, and what the government is actually proposing, and what the government will ask the House to decide? On Sky, he said he's not ruling it out. On the BBC, he said he was ruling it out. He's now saying they will keep it in reserve. And yesterday, Downing Street said vaccine passports are a first line of defence against a winter wave. What exactly is the position? Rather than zigzagging all over the place on vaccine passports, can we just get clarity, and can the House make a final decision on whether we think vaccine passports are appropriate intervention or not?
Thank you, Mr. Speaker. The right honourable gentleman's number of questions, let me just quickly plough through them. On Plan A, which you've made clear that is absolutely our focus, that is the situation we're in. Vaccines remain a critical part of it, testing and surveillance. Can I thank the right honourable gentleman for his support of our vaccine programme, including his comments yesterday. But he asked me also about your Plan B. I think is absolutely right. The government has a contingency plan, and the trigger, so to speak, for Plan B would, as I've mentioned in my speech, would be to look carefully at the pressures on the NHS. And if at any point we deemed them to be unsustainable, so if there was a significant rise in hospitalisations and we thought they were unsustainable, then we would look carefully if we need to take any of those Plan B measures. They would be informed by the data. Of course, we would come to the House at the time and take make the appropriate response. It's really important, I think, to just emphasise, because we can't do enough, the importance of vaccines. As I said, Mr. Speaker, we now know from data just yesterday from the ONS that in the first half of this year, 99% of those people that died from COVID-19, sadly, were not vaccinated. And it just shows us, that really highlights the importance of vaccination. The right honourable gentleman asked about people that are immunosuppressed. He will see that in the plan we published today, we set out more details around that, including treatments that are either currently available or treatments that may soon be available. I've mentioned the work of the Antivirals Task Force. It's doing great work, and there are a number of possible new treatments, and it's something the UK is very engaged in. Also, for those immunosuppressed that can take the vaccine, the right honourable gentleman will know that I think it was just last week that we announced a third dose as part of the primary treatment, and that again is a reminder of the action that we're taking, that our advisors are constantly looking at to see what more we can do. The right honourable gentleman asked about the flu risk, and it is a significant risk this year, a really significant risk, not least because for reasons that we're all familiar with, there wasn't much flu last year. There's a lot less sort of natural immunity around in our communities, and the flu vaccine itself it does have flu vaccine for not just in the UK but being deployed across Europe, has less efficacy than normal, but it is still effective. It is still a very worthwhile vaccine, and that's why we will be trying to maximise uptake, as I said, that with the biggest rollout programme and communications programme this country has ever seen for the flu vaccine. On diagnosis, the right honourable gentleman made a good point, and that is something that we're looking at with COVID and flu jointly. On testing arrangements, I think I've set them out clearly, Mr. Speaker, in our statement. We have no plans to change the current arrangements, but of course we constantly keep that under review. But as long as those tests are needed and needed available free for the public, that will be the case. But as I say, we will keep it under review. And then in terms of infection control in social care settings, there is a substantial amount of funding available. We have already made available for this year, this financial year, some £34 billion of funding in total for NHS and the care system for a lot of these extra measures, and that is a huge amount of funding, and much of it is going towards essential work like infection control, and we will make sure that what is needed is there. And his last question around vaccine-only certification, I think I've made the government's position clear. It is not something that we are implementing. We're not going ahead with any plans for that. I think for any government to do something like that, it would be such a big decision, and it would have to be backed up by the evidence and the data. That evidence is not there, and I hope that it will never be that situation, but to keep it in reserve is the right thing to do.
Chair of the committee, Jeremy Hunt.
I welcome this announcement, particularly on boosters. Yesterday I asked the Vaccines Minister when we were going to hear about boosters. Just 15 hours later, the Secretary of State is making a statement. It's almost as if the government is listening, and it's very, very good news. Can I ask the Secretary of State, though, nowhere wants to get back to normal more quickly than the NHS itself. Will he commit that the backlog in mental health treatment will be treated every bit as seriously as the backlog in physical health, and in particular that the NHS and the government will continue to adhere to the mental health investment standard, which says that mental health spending will increase at a higher rate than overall NHS spending, particularly when it comes to the extra money coming from the levy, because parity of esteem is supported on all sides of the House, legislated for in this House, and there is a lot of worry in the mental health world that the money from the levy will not reflect the needs of mental health backlog.
Mr. Speaker, I mean, first of all, I always listen to the former Health Secretary. He's always got some good advice, and I'm pleased to think that he thinks the government's moving quickly. On the backlog and mental health, he's absolutely right to raise this issue. The government is absolutely committed to parity of esteem. It's not just in law, it's in our manifesto, and I want to take this opportunity to reassure everyone who's particularly concerned, may have raised this issue with my right honourable friend, that commitment remains, and also this new funding that will go in over the next 3 years to help deal with the backlog. It absolutely includes mental health funding.
Yeah. SNP spokesperson Martin Day.
Thank you, Mr. Speaker. May I start by extending my condolences and those of my party to the Prime Minister on his family bereavement. I'm also grateful to the Secretary of State for advance sight of his statement, and I would echo his call for vigilance and the importance of getting vaccinated. With regards to COVID data, it has shown how few deaths between January and July were amongst the fully vaccinated, and clearly demonstrates the effect of vaccines in driving down deaths, a message which we have to all take home to our constituencies. Now, with winter approaching and more favourable conditions for transmission of the virus to take place, it is welcome that we are extending vaccines to our younger citizens, and also the news on booster vaccines. However, what more does the Minister think can be done to encourage the 1 million people over the age of 60 who have not yet been double vaccinated to become so? The winter will be a difficult time for many people in the UK, with the annual flu wave potentially coinciding with another COVID wave, the disruption this will entail immediately after the end of furlough and the universal credit uplift, coming as it does at a time of rising fuel bills. Why is the UK government insisting on ending 2 of the key measures supporting people through the pandemic shortly before a potentially difficult winter month for millions? And it is absolutely essential that self-isolation remains affordable. Finally, Mr. Speaker, the UK government has cancelled a contract with vaccine company Valneva, which was set to produce vaccines for the UK and Scotland at its Livingston facility. On these benches, we would be very grateful if the Secretary of State could provide an explanation as to why this deal was cancelled before the trials were even completed and threatening jobs in Scotland.
Yeah, Mr. Speaker, I mean, first of all, can I thank the honourable gentleman for raising again in this House the importance of vaccines. I agree with him wholeheartedly in what he said about vaccines, and he's right to think about what more can be done to encourage people, particularly older people over 60s, throughout the UK to take up more of this offer for vaccination. There are a number of things being done, I know both here in England and in Scotland as well, to focus on this, but including making greater use of family GPs and also just taking the time that is necessary to allay people's concerns where they are hesitant and to allow them to speak to the clinicians that they want access to give them that comfort. And that work will continue, and we're constantly looking for newer and perhaps even better ways to do that. On universal credit, when the government announced that increase, it was made clear that it was temporary, and I think being temporary at some point it has to come to an end. I think the time for that is now, as our economy has thankfully started to reopen. The availability of jobs is increasing. Economic growth has come back. I think this is the right time to do it, but also to continue to provide the type of financial support that is absolutely necessary, such as for those that self-isolate, which is something I touched on earlier. And then lastly, the honourable gentleman asked me about Valneva. I should be careful what I say. There's a commercial contract, but it might be helpful for the honourable gentleman to know that I have been in touch with the Health Minister in Scotland, and he is fully aware of the situation, and we remain in dialogue.
Mr. McVeigh.
Apologies. Thank you, Mr. Speaker. Given that the number of hospital beds has fallen by over 6,000 since the pandemic, figures sent to me by his department, will the Minister assure me that proper additional capacity will be built back into the NHS as part of his plan, rather than resorting to hugely damaging lockdowns and restrictions?
Yeah, I thank my right honourable friend for that question, and she's right to raise the importance of capacity in the NHS, and she will know that the reason for the fall in capacity in the first place is to control the spread of the virus, to make sure that those in hospital that are naturally vulnerable in any case are protected from the virus. And at the moment, hospitals will have what are referred to as sort of green channels and red channels, trying to segregate between those that have the virus and not. And this is something I can assure her that the NHS is keeping under review and would like to get rid of this segregation as soon as possible. And when it does, it will increase capacity.
Thank you, Mr. Speaker. What are the Secretary of State's plans for communications with immunocompromised people who do not yet know how effective the vaccine is for them? As the Shadow Minister said, this group accounts for 13.1% of deaths within the fully vaccinated population, despite making up less than 1% of the general population. And does he not agree that we should be advising them not to return to unsafe workplaces until we know more?
The Honourable Lady's right to raise this is such an important issue, and that is why we have, throughout the pandemic, offered advice and given guidance through clinicians working with the NHS for those that are immunocompromised, and that is constantly updated as the nature of the COVID threat is constantly changing. And where we get advice to take further action, so a moment ago, Mr. Speaker, I referred to for certain people that are immunocompromised but they can take the vaccine, we receive clear advice that the antibody response from 2 doses wasn't enough in most cases, that there should be a 3rd dose as part of a primary course, and that is why we accepted that advice and acted on it immediately. And I think that affected about 500,000 people in that category, but we will continue to keep it under review and do whatever we can.
Rainblade.
Thank you, Mr. Speaker. I welcome the government's rethink on vaccine passports, and I hope it presages a move to trusting people more to make decisions for themselves. The Secretary of State will know there is evidence now that people returning from green list and amber list countries over the summer actually had a lower level of COVID than people who stayed here during the summer. Does he accept that makes a very powerful case for getting rid of the day 2 PCR test for people returning from those countries?
Mr. Speaker, my right honourable friend is right to raise this, and it's the reason why we have constantly kept our travel rules relating to COVID under review. And in my statement earlier, you may have heard I refer to a set of changes that we are looking to make very soon. And my right honourable friend, the Transport Secretary, will be bringing forward those changes to the House as soon as he possibly can.
Diane Abbott.
Thank you, Mr. Speaker. The Secretary of State quite correctly is urging people to get vaccinated. He will be aware that there are certain ethnic minorities that have relatively low vaccine take-up, sadly. And we see this, for instance, in my own borough of Hackney. Is there anything that he has considered that the government could do nationally to support outreach to ethnic minority communities?
Yeah, the right honourable lady makes a really important point. We want everyone to take up their offer of a vaccine, and she's right to point out the disparity in take-up based on certain communities. I think the good news is we have certainly noticed, partly I think as a response to government action and some fantastic people, especially I've come across, for example, in London in the public health, working for Public Health England, that have reached out to communities to increase uptake, and we have seen a significant increase in uptake in the communities that she refers to over the summer, but that's work that continues and it remains a priority.
Robert Halfon.
Thank you, Mr. Speaker. I welcome the boosterism programme for the vulnerable that my friend has set out today. But could I just ask him about this vexed issue about parental consent? Because the NHS website states that it would be rarely appropriate or safe for a child to consent without parent involvement, and a parent's consent must be sought prior to vaccination. So can my honourable friend confirm whether it's the intention to follow this advice, and if not, on what legal basis has that decision been made? Because the Gillick and later case law was intended for a far more narrow set of circumstances and a mass rollout of treatment to otherwise healthy children. Yeah. So if he's going to make the decision to ensure credibility in the system, there has to be parental consent.
Yeah, Mr. Speaker, I would like to reassure my right honourable friend on this, in that the legal basis that we are following for vaccinations, in particular in this case for child vaccinations, is the one that's been set out since the 1980s and been used by, applied by successive governments for all child vaccinations, and the way the offer of a COVID-19 vaccine will work will be no different to the current processes deployed. And that does require, in the first instance, to ask parents for their consent. And I'm told by the school age immunisation service, these are the sort of specialists within the school system that work on child vaccination, that in the vast majority of cases there's no dispute between what a parent decides and what the child might decide, and that's and it sort of just works quite normally in that way. Where there is a difference of opinion, perhaps between the parent and the child, then the school age immunisation service will try to reach a consensus, bring both parties together, and only in those rare situations where they cannot reach a consensus, then the process that is followed, called Gillick competence, is a process by which it would have to be determined if the child in question is competent enough to make decisions regarding their own health. And in general, I am told that the older the child, the more likely there is to be a decision that they are competent enough. But I can stress that this is the process followed for decades now under successive governments, and we won't be changing that process.
Clive Efford.
Thank you, Mr. Speaker. We know that the ring of protection that the government spoke of last year was non-existent and left many vulnerable adults in social care exposed to infection. So can the Secretary of State say what resources specifically are going to be made available for care homes this winter so that we can ensure that they have the staffing levels that they need, and to prevent the sort of devastating infection rates that we saw last year?
Mr. Speaker, I can tell the honourable gentleman that we have already planned to spend an additional £34 billion this year on both NHS and care homes, helping to pay for additional measures such as infection control measures, some additional staffing costs, and we constantly keep that under review.
Angela Richardson.
Speaker, can I echo the comments my right honourable friend and constituency neighbour, the chair of the Health Select Committee, made in raising concerns about mental health? I'm dealing with a constituent at the moment who's been sectioned under the Mental Health Act, but there were no beds in Surrey and she's been had to be moved to Kent. Would my right honourable friend look at increasing capacity in those most severe cases so that families don't have to undertake the journey in what is already a difficult set of circumstances for them?
Mr. Speaker, my honourable friend is right to raise this. It's a very difficult situation, and of course I think everyone in this House understands, and it is one of the reasons why we are increasing capacity. There is new funding and support, and it's something that remains a priority.
Manira Wilson.
Very much, Mr. Speaker. Could I start by extending my condolences and, on behalf of my party, their condolences to the Prime Minister and his family today. Mr. Speaker, children and young people have done everything that's been asked of them through this pandemic, as have their parents. Yet children have paid a high price in terms of lost learning and, in particular, their mental health. Yet they've been an afterthought for government throughout. It's all very well announcing today that the power to close schools in the Coronavirus Act will be expired. It makes a great headline, but the Health Secretary is well aware that power was never used previously to close schools, just guidance from the Education Secretary. So will he give pupils and parents across the country a cast iron guarantee today that his government will not close schools again this winter?
Mr. Speaker, I think the Honourable Lady will agree that we are, as a country, in a much better place today with COVID than we saw even at the start of this year. And that is down to many factors, a number of those I've referred to in my statement. But I believe with the measures we set out today that we can be confident that our children will not have to go again through the kind of disruption that they've seen in the last couple of years.
David Davis.
The distinguishing characteristic of the Coronavirus Emergency Act was not so much the new powers, which already existed in the Civil Contingency and other acts, but the fact that the ministers were not required to get them approved by Parliament before implementation. And it's one of the reasons for the poor quality of some of the decisions taken in the last year. Can he give an undertaking that any new regulations, and indeed any regulations he retains, will be put to the House before implementation, including vaccine certification if the government's unwise enough to pursue that course.
Mr. Speaker, I can tell my right honourable friend that when the government, any government, makes decisions that has such an impact on people's liberties, even if those decisions are made for all the right reasons, in this case, of course, to deal with this pandemic, then it should be working with the House and working with colleagues, and any measures that are significant, of course, they should come to the government, will come to the House and seek a vote of the House.
Dame Meg Hillier.
Thank you, Mr. Speaker. The Secretary of State talked about international work, and unless we tackle this across the world, we're going to be in a pandemic forever. So when he was at the G20 and he shared with other countries what we're doing to help tackle it internationally, could he please share with the House what's being done to tackle vaccination rates across the globe?
Yeah, Mr. Speaker, I can tell the honourable lady that there was significant discussion around this with my G20 colleagues, but not all of them have, let's say, behaved in the same way as the UK in offering donations to poorer countries of vaccines. The honourable lady will know that we are committed to 100 million doses, to offering those to international friends, and that already we have provided or donated 9.2 million doses, most of those through the COVAX programme. We remain committed to that programme. And one of the things that we are trying to do internationally, including through the Foreign Secretary, is to encourage more countries to both honour their commitments to COVAX, and those that haven't joined the COVAX commitment to come forward and help in that way.
Dean Russell.
Thank you, Mr. Speaker. Across Watford, we are served by some amazing GP surgeries, including the Man of View practice and their team. But I am hearing from constituents that some GP surgeries are still not opening their doors to do face-to-face appointments. And could I ask if you would agree with me that actually we should encourage those GP surgeries to start opening up to help with the backlog and help see people face-to-face?
Yes, I agree with my honourable friend, Mr. Speaker. He's right to raise this, that I think everyone can understand why during the height of the pandemic, GPs couldn't provide access in the normal way. But we are way past that now. Life is starting to return almost back to complete normal. And as that is happening, it should be happening in our GP surgeries too. And more GPs should be offering face-to-face access, and we intend to do a lot more about it.
Hannah Bardell.
Mr. Speaker, Secretary of State rightly speaks of the importance of vaccines, and Valneva in my Livingston constituency is playing a crucial role in the global fight against COVID, and have worked incredibly hard to augment and adapt their work on a vaccine as new variants have emerged, as requested by his UK government. So, Mr. Speaker, you can imagine their shock and mine that their contract to produce 100 million vaccines was cancelled with very little notice or consultation. To compound that shock, there appears to be little clarity and reasoning. And whilst I won't repeat the rumours printed in the media, does the Health Secretary not agree that this is a shocking way to treat a company working tirelessly on a vaccine? And will he meet with me to ensure the future of the site, its work and its workers are secure, and rethink this disastrous decision?
Mr. Speaker, I have to say to the honourable lady, I don't agree with her. There are commercial reasons that we have cancelled the contract, but what I can tell her is that it was also clear to us that the vaccine in question that the company was developing would not get approval by the MHRA here in the UK. And obviously she is not recommending that we administer vaccines that don't get approval. I do understand her point about Livingston and the factory in Livingston, and that is very important to the UK government, of course to the Scottish government, and that is something that we will be working together on to see what more we can do.
Dr. Luke Evans.
Speaker, a clarification and a request. On the clarification, I welcome the boosters. Could he clarify for people who've had either the AstraZeneca or the Pfizer, will they be having the same vaccine or mixing a vaccine? And a request, one of the slowest things when it comes to dealing with the Pfizer vaccination is the 15-minute wait you have to sit through to see you don't have a reaction. We now should have the data. Will he ask the NHS to look whether this could be removed to relieve some of the pressure on those delivering the vaccines over the winter?
Mr. Speaker, so on the booster programme, everyone will, on that programme will be offered either the Pfizer vaccine or half a dose of the Moderna vaccine. I think in the vast, vast majority of cases, it will be the Pfizer vaccine. And in terms of the data that's now available on that 15-minute wait, we are analysing that and see if it makes if we can make any difference to the way we administer vaccines.
Jack Trumby.
Mr. Speaker, Jane Roach from Erdington lost her father to COVID and then 5 days later lost her sister to COVID. They led the hundreds of families who came to London last week down the Memorial Wall, calling with one voice for the promised inquiry to take place. They are frustrated because they want not just for their families to know why they died, but for no one else to die as a consequence of mistakes made. When will the Secretary of State and the Prime Minister agree to honour the pledge that has been made to meet with COVID families for justice? Because they have a right to be heard at the next stages.
Mr. Speaker, the honourable gentleman is right to raise the concerns of Jane and many others up and down the country and express her frustration in the way that he did. I am certain, Mr. Speaker, that when this inquiry gets going, that people like Jane and many others will have the opportunity to set out their views.
Mark up.
Mr. Speaker, first of all, thank you for granting the statement last night. I think it was important the House heard an early opportunity of the government's decision. Regretfully, there were one or two inadvertent inaccuracies in some responses to the questions, but I'm very pleased to say, having raised those with the Minister, who I respect greatly, a correction has either been made or is going to be made very quickly, and I think that's admirable from the Department that they've sought to put the record straight at a very early opportunity. Can I ask the Secretary of State, in his statement, he said that regular asymptomatic testing of those in education will continue in the coming months. Now, my understanding was there was to be a review at the end of September about regularly testing children that have no symptoms. Is that still going to continue? My view is that we shouldn't be regularly testing children who have no symptoms, only those that have symptoms. And that is also the view of the Royal College of Paediatrics and Child Health. So can I urge the Secretary of State to drop regular asymptomatic testing of children? I think that will be good for their education and good for their mental health.
Mr. Speaker, my right honourable friend raised the issue of yesterday's statement, and I'm pleased he's accepted that the Vaccines Minister had inadvertently, I think my right honourable friend was referring to whether the Department had received the advice from JCVI on boosters, and the Vaccines Minister was not aware at the time he was making the statement that we had actually received it, and as he says, it was inadvertent, and the Vaccines Minister has put a letter of correction, or has done a letter of correction, which I think is going to the Library of the House today. On asymptomatic testing of school children, that is planned to continue for this month. Whether we continue beyond that, I'm not aware of a final decision that's been made on that. It's something that my department consults with the Department for Education. But the general point that he's making is that we should end this as soon as we can, and especially if we believe it's not making much of a difference. Of course, we keep that under review, and if we continue with it, it must be supported by the evidence.
Dame Angela Riedel.
Thank you very much, Mr. Speaker. As Secretary of State, in Wirral there's been a 13% increase in 1 week in levels of infection, and sadly 4 people died in hospital after a period of there being very, very few deaths indeed. So we're at a much higher level of infection rates. Can he tell the House what level of deaths the government will be prepared to accept from COVID before they think of taking measures to try to prevent the ongoing spread?
Mr. Speaker, of course, no one wants to see any death from any disease, including COVID. But I think that as we've learnt more about COVID, I think everyone understands that it's not completely preventable, but it's our vaccines that are making a difference in Wirral and across the country. I mean, no level of deaths I would describe as acceptable. The job of the government is to keep that at an absolute minimum, but not just COVID deaths. We also have to be alive to deaths from cancer, from heart disease and things. And she will know when we had the height of the restrictions, many people were suffering in other ways because they weren't able to go to the NHS, and we have to keep that top of our mind too.
Andrew Slew.
Been very tough for all health professionals. So will the Secretary of State wholeheartedly condemn the abuse which some GPs have been suffering recently? And if vulnerable people are unable to get through on the telephone to their surgery, is it the clinical commissioning group or the department that should step in and try and sort that out?
Yeah, I absolutely would join my honourable friend in condemning anyone that gives abuse to our fantastic GPs up and down the country. And if someone cannot get through to their GP, the answer is they should try, certainly with their clinical commissioning group first. If for any reason that doesn't work, then please come across to the department and consult ministers.
Emma Lewell-Butt.
Thank you very much, Mr. Speaker. The Secretary of State has not delivered a concrete plan today. No real clarity on thresholds for further lockdowns or details of what draconian and unnecessary powers in the Coronavirus Act he wants to hold on to. Can he at least say when this soon-to-expire Act will be back before this House for a vote?
Can I suggest, Mr. Speaker, that the Honourable Lady reads the plan before she comments on it?
Steve Bryan.
Speaker, I welcome much of what is a sensible plan today from the Secretary of State, although I do have a creeping feeling we're preparing to treat flu like COVID more than the other way round. But before we start extending the vaccine programme and boosters, can I ask the Secretary of State to get a grip on a creeping issue, which is people who've had one vaccination in England and another one in Scotland, or the other way round, the two systems are not talking to each other, and they're then not getting the benefits of being fully jabbed. So we need to deliver for those who've done what we've asked them to do before we deliver vaccines to others.
My honourable friend is absolutely right to raise this, and I have people in my own family who've had that very issue. And it is something that I know the Vaccines Minister is looking at, but I also have discussed it with the Health Minister in Scotland, and we are working to see what more we can do.
Dave Dugan.
Thank you, Mr. Speaker. As we go into another winter, placing our community's welfare in the hands of health and social care staff, can the Secretary of State reflect on the fact that in England the 3% NHS pay rise does not marry up well to the 4% backdated in Scotland? Why will the Secretary of State not place the same esteem on health and social care staff in England as we do in Scotland?
Mr. Speaker, when it came to the pay rise the honourable gentleman referred to, we accepted the recommendation of the independent pay review body, and I think that was the right thing to do.
Greg Clark.
Is my right honourable friend aware that the likely course of the pandemic is that more and more people, vaccinated or not, are likely to be infected by COVID, but the levels of protection from the vaccines will keep them from serious disease? So will he say something about the triggers for any future lockdown or other restrictions, and confirm that the expected increase in the transmission of COVID will not be among them?
Mr. Speaker, my right honourable friend is right about of course, the importance of vaccines, and in terms of any potential triggers. I think one thing I would highlight, Mr. Speaker, that I haven't mentioned so far today in Parliament is the importance of being on guard against future variants, but especially if there is ever a variant that is let's say, a vaccine escape variant. No one can rule that out. That is why our surveillance system is so important. But in that situation, I think the government would have to take further action. We couldn't say what that action would be today, but that is the kind of risk that we need to be on guard.
Diana Johnson.
Thank you, Mr. Speaker. In Hull, we have the second highest rates of COVID infection in the country. And in one of the wards in my constituency, only 51% coverage of second doses of the COVID vaccination. Of course, the Secretary of State said the national average is 81%. So this figure, it seems to me, goes to the heart of the problems we have with regional inequalities and health inequalities. And I'd like to know what the Secretary of State is going to do to make sure that we maximise the number of people in Hull who receive the vaccination, and we don't have people in Hull left behind in the recovery.
Mr. Speaker, of course, no one should be left behind wherever they are in the UK. The differential take-up of the vaccine can be based on a number of factors, but there's definitely a difference in age groups, for example. And so what we are trying to do, working with the NHS, is we tailor our message about trying to convince people about the benefits of the vaccine, to those respective age groups, and we also try to do it on a localised basis. If the Honourable Lady has any particular suggestions around Hull, we'd be more than happy to listen to her.
Sir Desmond Sway.
He retains all the powers of the 1984 Public Health Act, which were used to take away our liberties without parliamentary prior authority. Will he undertake to review and to give us a new Public Health Act?
Mr. Speaker, we keep all rules and acts under review at all times.
Ben Bradshaw.
He will know from the discussions he describes with international colleagues that while travel in the rest of Europe has recovered to 60% of pre-COVID levels, it's a fraction of that here. So when will he scrap the outdated, unnecessary and hugely expensive travel testing regime, save what's left of an industry and end the situation where foreign travel has once again become the preserve of the rich?
Mr. Speaker, I'd say two things to the right honourable gentleman. I mean, first of all, that it is important that we have a system of surveillance, especially around variants across the world. There are different ways to do that. We've chosen a particular path at the moment, but it is important to have that surveillance. I hope he agrees. And as I alluded to earlier in my statement, we are planning to make some changes around the travel regime, and my right honourable friend, the Transport Secretary, will come to the House as soon as he's ready.
Secretary Batty.
Mr. Speaker, time and time again I'm hearing from constituents of mine that they can't get face-to-face appointments with GPs, and I know they're under immense pressure. Further to the answer my right honourable friend gave to my friend from Watford, would you be able to elaborate on what work he and his department are doing to encourage GPs to give face-to-face appointments to those individuals who need them?
Yes, I can, Mr. Speaker, and that again, it is a very important issue. We are working with the BMA, the NHS and other important organisations on this, and there are a number of things that I think that we can do, but we are trying to do so by agreement at this point. But he's right to raise this issue, and as I said earlier, it is high time that GPs started operating in the way that they did before the pandemic and offering face-to-face appointments to everyone who would like one.
Sajid Javid.
Mr. Speaker, in the Health Secretary's statement, the first matter he mentioned is the importance of vaccines. But we know that 40% of the world's population has been single vaccinated against COVID, but only 1.8% of those in low-income countries have been vaccinated and are not on track to vaccinate their populations until 2023. To be frank, Mr. Speaker, this government has previously taken a dangerous route in their international policies, like their anti-refugee bill, for an insular Britain. So my question is, will the government commit to ensuring the UK plays its part in vaccinating the poorest nations in the world, firstly to save lives, and secondly to avoid the potential emergence of further COVID variations?
Mr. Speaker, we are more than playing our part.
Hugh Merriman.
Mr. Speaker, thank you very much indeed. I know that the international travel sector will welcome the framework. Given that it will come out on the 1st of October, will that give colleagues and indeed select committees the opportunity to feed in their ideas on behalf of their constituents, and will he entertain the idea of moving to lateral flow tests, which are cheaper, and then only the small proportion of positive cases would then need to take up a PCR test?
Mr. Speaker, I know these are important issues for the House, but particularly for my honourable friend, the Chair of the Transport Select Committee. I don't want to preempt the statement of my right honourable friend, the Transport Secretary, but I believe that, that when he makes that statement, that my honourable friend will be pleased.
Alistair Carmichael.
Very much, Madam Deputy Speaker. Pages 23 to 24 of the Autumn and Winter Plan specifies that as part of the Plan B, the Government will introduce vaccine passports for all nightclubs, indoor settings of 500 people or more, which presumably would include this chamber of 650 members, outdoor settings of 1,000 or more, or anywhere which is a very big place, anywhere where there are 10,000 people. How does the Secretary of State square that with his assertion in reply to the Shadow Secretary of State that the evidence on the usefulness of vaccine passports is just not there? If the evidence is not there, why are they part of the Plan B? And the government's document also says that Plan B could be brought into force at very short notice. So can he give the House some assurance that it will not be without a vote?
Short questions and short answers. Secretary of State.
Speaker, we have made huge progress as a country in fighting this virus, and that is why we don't need certification. We don't need the issues that the sort of Plan B issues the Right Honourable General has just set out. And as I made clear in my statement, that whilst we can keep other measures in reserve, what matters is what we are actually doing, and if we keep making progress against this virus in the way that we are, we won't need any of those things he's talked about.
Jason McCartney.
Thank you, Madam Deputy Speaker. It's worth highlighting once again the latest stats from ONS that show that almost 99% of COVID deaths in the first half of this year were people who had not received both doses of the COVID-19 vaccine. That really does show the importance of our world-leading vaccination programme. So can the Secretary of State say that as we roll out these booster jabs, how will he build on the success of the network of GP surgeries, community pharmacies and volunteers who have helped roll out, in particularly my part of the world, all these COVID vaccinations?
Yes, my honourable friend is right to raise this. The booster jabs are going to be hugely important in maintaining protection. And the GP networks, the NHS vaccination centres, they've all been part of our planning for this. And given that these are booster jabs, I think we can move much more quickly than we did with the original doses.
Emma Hardy.
Deputy Speaker, parents will have questions and concerns, quite rightly, but can the Minister confirm that those questions and concerns should not be directed to school staff or head teachers, even if the vaccination happens to take place within a school building, and instead all questions related to the vaccination should be directed to the appropriate medical team?
Secretary of State.
Yes.
Steve Baker.
Speaker, my honourable friend, amongst other things, is keeping COVID status certification in reserve. He's leaving mass asymptomatic testing in place together with contact tracing. As my right honourable friend said, the public health powers are still there, of course allowing him to lock us down at the stroke of his pen without prior votes or any formal way of justifying the proportionality of those powers. So when can we expect all of these things to be dealt with so that we can all have the certainty that will come from knowing that we're living with an endemic disease, living with the disease thanks to the vaccine in the way that we live with the endemic disease flu, so that we can all get on with our lives?
Madam Deputy Speaker, I know that my honourable friend may not agree with every measure that the government is keeping in place or set out, but I hope he agrees with me that the measures that I've set out around making sure that we are vaccinating the public, offering vaccines to as many people as possible, having some kind of testing regime and having some surveillance of the results of these tests to look out for any new variants. I hope he agrees that at least those measures are the right measures and the kind of things that need to be done as we live with COVID-19.
Patricia Gibson.
Thank you, Madam Deputy Speaker. Vaccine passports, we were told by the UK Government they were going ahead, then they weren't going ahead, then we were told they're still the first line of defence against a winter wave. Now the latest position is they're a definite maybe. Now, this is dithering we haven't seen since the great confusion over mask wearing, which can be seen if you look around this chamber. How irresponsible does the Secretary of State think that this dangerous and confused public messaging during a health pandemic actually is?
Secretary of State.
Madam Deputy Speaker, I believe we've been very clear on this issue.
Jane Hunt.
Thank you very much, Madam Deputy Speaker. Last Friday, Leicestershire MPs met with NHS officials locally. We were told that around 3/4 of all in hospital with COVID were not vaccinated. Would my right honourable friend agree with me that if we do not want to be in lockdown this winter, we should all, who can, should get the vaccine, especially in Leicester, where I now understand that the Shadow Minister's earlier comments take-up is only 61%.
I agree, Madam Deputy Speaker, with my honourable friend. There's some 6 million adults throughout the UK that remain unvaccinated, and I think we should all do what we can to at least encourage them to think about taking the vaccine, not only to protect themselves, but to protect their loved ones.
Rachel Maskell.
Thank you, Madam Deputy Speaker. I'm seriously concerned about the hole in the Secretary of State's defence. That taking away contact tracing from public health teams, the data that is coming through is completely insufficient now to carry out an effective operation locally and therefore to lock down the virus, not people in the future. Will he look at this and ensure that local authorities like in York, we can have that zero data so we can get on top of the contact tracing as soon as the data emerges?
Madam Deputy Speaker, there are measures that, when it makes sense, we must remove. And the reason that we can take a different approach to contact tracing than we did a few months ago is largely down to the high rates of vaccination we're seeing throughout the country. Of course, we want them to go higher, but as we vaccinate more, it allows us to start removing these restrictions, these additional costs, these burdens on individual livelihoods, and it is right approach that I think we take. We take a balanced approach, keep increasing vaccination so we can keep removing other restrictions.
Simon Clark.
Thank you, Madam Deputy Speaker. I welcome the Secretary of State's statement today. Can I just raise the plight of care home residents, many of whom have been kept apart from their families and loved ones owing to outbreaks being declared in their home? Obviously, we need to set a proportionate balance here, but I think the threshold for intervention by declaring an outbreak is really quite low. Could the Secretary of State commit that he'll look at this so that we can ensure that people can see their loved ones throughout the winter ahead?
Secretary of State.
Yes, Madam Deputy Speaker, I can give that commitment to my honourable friend, and also he may be interested to know that with the booster announcement today that care home residents will be an absolute priority.
Leila Moran.
Madam Deputy Speaker, back in June, the Prime Minister committed the UK and other G7 nations to vaccinating the world by the end of 2022, and I quote, to end this terrible pandemic. So can the Secretary of State tell this House how offering a third vaccine to a fully vaccinated healthy adult in the UK before a first vaccine to a nurse in a lower income country helps that goal of vaccinating the world by 2022?
Well, Madam Deputy Speaker, I do understand the point the Honourable Lady is making, but may I suggest, if she hasn't yet, she should read the JCVI's advice on booster vaccines, and I think then she might be able to better appreciate the importance of the booster programme.
Dr Ben Spencer.
Thank you, Madam Deputy Speaker. I thank my right honourable friend for his statement today, and I think we all hope that Plan B isn't activated. But on that, in follow-up to the right honourable friend for Tunbridge Wells, can he lay out exactly what unsustainable pressure means? And in his assessment of NHS capacity going forwards over winter, where does he see the bottleneck? Is it staff? Is it medication? Is it beds? And what work is being done to enhance that capacity?
Very good. Madam Deputy Speaker, what I can tell my honourable friend that when I talked earlier about unsustainable pressure, it would be things like looking at hospital occupancy, looking at the occupancy in particular in ICU units, the admissions of vaccinated individuals versus unvaccinated individuals, and the rate of growth in admissions. I know there's a lot there, but I think it's right that we don't have there's not one particular trigger, so we have to take a number of issues into account. But I hope he agrees the government is right to plan for all contingencies.
Jim Shannon.
Madam Deputy Speaker, on behalf of my party, the DUP, can I convey my sincere sympathies to the Prime Minister and his family in the death of his mum? Can I also thank the Secretary of State for his statement and efforts on behalf of us all. Will the Secretary of State confirm the booster rollout for over 50s will be managed in line with the flu jab rollout, which seems to be facing some delay? And will the Secretary of State further confirm that additional funding is being allocated to GP practices to enable this enhanced rollout to actually take place? Thank you.
Yeah, Madam Deputy Speaker, yes, GPs do get and will get additional funding to support the vaccination programmes, including a flu vaccination programme. In terms of co-administering, if that's what the Honourable Gentleman was asking, the COVID vaccine with the flu vaccine, whilst the JCVI in their opinion has said that there's no reason why that shouldn't happen, they think that can work, I think in practical terms, mainly because of the 15-minute wait after a Pfizer jab, that it will probably happen in very few cases, but regardless of that, the flu vaccination programme this year is also going to be very high priority.
Ruth Edwards.
Thank you, Madam Deputy Speaker. As my right honourable friend has said, it's been our vaccine programme that's enabled us to get almost back to normal. Will he join me in thanking the staff and the volunteers at Gampston Community Centre who've been rolling out the vaccine in Rushcliffe and giving my constituents the best protection they can have against coronavirus?
Yes, sir, Madam Deputy, of course I will. At Gampston Community Centre and community centres and village halls and so many other places up and down the country, including, of course, in her constituency, they've done an amazing job, and we still need them to help in our fight against this virus.
Gary Sandbrook.
Madam Deputy Speaker. As the Secretary of State may know, just next door to his own constituency in Birmingham Northfield, the vaccine take-up has been about 75%. But unfortunately, in some parts of Birmingham, it's been as low as 47%. And so will he join me in encouraging anyone who is hesitant to take the vaccine to take part in Birmingham City Council's quick 1-minute survey about why they have those anxieties? Because it's very important that we all understand where those anxieties lie, because after all, the vaccine is pivotal to our success.
Yes, Madam Deputy Speaker, I will join my honourable friend in encouraging people to do that. I think it would be a 1 minute very well spent.
Jack Brereton.
Thank you, Madam Deputy Speaker. Across Stoke-on-Trent and Staffordshire, uptake of the vaccine has been very good, and I'd like to thank all those who've been delivering the vaccine across Stoke-on-Trent particularly. But around for 16 and 17-year-olds, most 16 and 17-year-olds cannot use currently the online booking system. They have to wait for their GP to contact them or for one of the very few walk-in centres. So could my right honourable friend look at extending that online booking system to all 16 and 17-year-olds?
We do keep that under review, I can tell my honourable friend. At the moment, that we have found for 16 and 17-year-olds that the quickest way to encourage them to take up the offer is through the schools and colleges network and through GPs in particular. But we do keep it under review. But he might be interested to know that 16 and 17-year-olds, I believe the latest numbers are over 54%, I think, are vaccinated, and there's progress to be made, but it's good progress so far.
James Wilde.
Thank you, Madam Deputy Speaker. My local hospital, the Queen Elizabeth, which my right honourable friend knows needs to be rebuilt, currently has 46 COVID patients, and isn't the best way to ensure that the QEH and the NHS has the capacity to cope with the winter pressures, to increase the level of vaccine take-up, and will he ensure that evidence on what works in doing that is shared across the country?
I very much agree with my honourable friend, and that is one reason why we are constantly publishing more and more information on the impact and effectiveness of vaccines, including the data from the ONS today that I referred to earlier.
Sarah Brickliffe.
Thank you, Madam Deputy Speaker. The Secretary of State will be aware that Highburn and Haslingden has faced restrictions for longer than most in the country. Can he please clarify whether local restrictions are being considered by the government, and if so, what they might be?
Madam Deputy Speaker, I wasn't sure from the Honourable Lady if she's referring only to her own area or more generally in terms of local restrictions. There will, in terms of the plans that I've announced today, the government will retain some powers for local restrictions, working with local authorities if absolutely necessary. But if she is interested more in her own particular area and the current situation, I or other ministers will be happy to talk with her.
Paul Holmes.
Thank you, Madam Deputy Speaker. Like my honourable friend, the member for Watford, can I just emphasise to the Secretary of State the amount of anger there is in Eastleigh about not being able to get a face-to-face appointment with their GP. The Secretary of State stood at the dispatch box now and encouraged GPs to get back to work. If necessary, and that uptake hasn't happened, will he instruct them to get back to work so that we have face-to-face appointments for my constituents?
Yeah. Madam Deputy Speaker, I agree with my honourable friend about the importance of giving patients a choice. Now, there are some patients that actually prefer not to have a face-to-face appointment. They may be at work and they might like that kind of technology, and that's fine. But the important thing is for those that want to have a face-to-face appointment, it should be made available. The department and my honourable friend, the Minister, is looking at what measures can be taken, and she would be more than happy to meet with him to take him through some of those initiatives.
Anthony Higginbottom.
Very much, Madam Deputy Speaker. The NHS and volunteers across Burnley and Padiham have done a brilliant job at vaccinating people, but we know there's still hesitancy in getting the vaccine. That includes not only people who haven't turned up or don't want to have the first vaccine, but also those who have had the first vaccine but then are hesitant about the second. So can I ask the Secretary of State what steps he's taking to understand why that hesitancy is there and what we can do to try and get people the vaccine?
Madam Deputy Speaker, I'm pleased that my honourable friend has raised this, and this is an issue. It's in a very minority of cases, but where, as he says, someone's taken the first dose but become hesitant about the second. What we are doing in all those cases is that those people are being individually contacted, often by their GPs or other clinicians, and they're being offered meetings, their phone calls, and being talked to try and encourage them to take that second dose. It's really important that in that situation people follow up that with that second dose to get the full protection they deserve.
Tom Hunt.
Speaker, we've heard a lot about variants and how that could evade the vaccine. It wasn't that long ago that I was reading a lot about enhancing, tweaking the existing vaccines and potentially even like a universal vaccine that was a kind of like a variant boosting vaccine. What are things looking like in that regard, and what's the sort of time frame, possible time frame as to which we could release a vaccine that can better protect us against variants?
Madam Deputy Speaker, I think it's reasonable to assume that at some point in the future, perhaps as early as next year, there may be what are referred to as bivariant or perhaps even multivariant vaccines, as for example the flu vaccine is a multivariant vaccine. In terms of availability and getting approval from regulators, we're not there yet, but I do believe that's the general direction of travel, and when we do get there, I think it will be much harder, much easier to live with COVID-19.
Question Aaron Bell.
Thank you, Madam Deputy Speaker. My constituents in Newcastle under Lyme have very much enjoyed getting back to normal these last few weeks, and so I believe they'll welcome what the Secretary of State said in his plan, and particularly his Plan A. Does he agree with me that whilst we must not be complacent, we must also not be overcautious? And to that end, what assessment has he made of the data of the last few weeks, and whether that utterly vindicates the government's decision to proceed on the 19th of July, a decision they took in the teeth of some opposition?
Yes, Madam Deputy, my honourable friend is absolutely right to raise this. There were many people, including many in this House, including especially those on the opposite benches, that told us that the decision that we made to go ahead with Step 4 and remove all those restrictions was the wrong one. I think clearly events have shown we've made the right decision. The status at the moment with the pandemic is that the cases are steady. We, of course, have to remain vigilant, but my honourable friend makes a very fair point.
I thank the Secretary of State for his statement, and we now move on to point of order. Carol Monaghan.
Thank you, Madam Deputy Speaker. Yesterday, during the statement on Afghanistan, the Minister for Afghan Relocation said, "We have to be very careful about offering either encouragement or support for people who may be in a perilous situation in Afghanistan on making that journey to borders." She also sent a letter, a dear colleague letter, that said we cannot pursue cases concerning Afghan people in country in the usual ways, and asked us to signpost them to gov.uk for the latest info on ARA and ACRS. Therefore, it was surprising to hear a member on the benches opposite yesterday say, "I pay enormous tribute not only to my honourable friend the Minister, but to the Home Secretary, whom I was texting barely half an hour before I came into the chamber about an Afghan who is currently near a border, and she was personally sorting out the transit documents that I hope will enable him to come through." Now, I'm very pleased that that individual was able to make the journey. But it seems we have a two-tier system here for advocacy. I, and probably many members here on these benches, do not have the Home Secretary's phone number. So I'm just wondering how I can raise cases, because I've been inundated with cases. I've got a large Afghan community in my constituency. I've been inundated with cases with people who are concerned. So how do we raise such cases?
Well, I'm grateful to the Honourable Lady for giving me notice of her point of order, and I'm sure she'll understand that it's not for the Chair to police how Honourable and Right Honourable members communicate with each other. However, it is extremely important that all members are able to make effective contact with government departments, and that all members get responses in good time. And I feel that that is particularly true in the case of Afghanistan, where many of the issues are of the utmost urgency. I do expect ministers, and I know the Speaker expects ministers, to do everything they can to make sure that they and their departments are responsible to all honourable and right honourable members. And I hope that the Treasury bench will feed back the concern that has been raised. Thank you. Point of order, Leila Moran.
The two.
So,
I thank you very much for your answer, because it helped to clarify, and I thank my honourable friend for raising the point of order. I mean, I share the concern. I've got 400 Afghans that my office alone is supporting, but I just want to point out, in the Dear Colleague letter, it seemed to suggest that all the correspondence that MPs have been sending to the department, and I would like to quote from this, if I may, "We cannot pursue these cases concerning, and we will consider how the data will now be used in the future." It suggests that all the correspondence that we have sent will not be answered, and furthermore, it says to us not to write to them. Is that proper? Because in my time as an MP, it's been 4 years now, sometimes they've been late, but the letters have always come back.
The honourable lady for that further point of order. I know this was something that was raised in the urgent question yesterday quite a few times, and again I'm sure the Treasury bench will take back that point and ensure that that members and right honourable members are clarified as to the situation. Point of order, David Davis.
Deputy Speaker, I raise point of order really partly for information and partly in the role of the Chair in protecting the rights of the House. We have very important business today being taken all stages in one day. This is incredibly unusual. Normally it's only done for matters which are very, very urgent, typically terrorism legislation with imminent terrorist attacks and so on. The last time it was done inappropriately was the DRIPPER Act, Data Retention Investigatory Powers Act, which you may remember I took the government to court on, and the government lost at all levels. And I wouldn't like to see something like that happen to the business today. Can you tell the House, Madam Deputy Speaker, when the government brings such a proposal to the House, who approves it? Is it the Speaker? Is it the front benches of the opposition? Is it an instrument of the House? How does it come that we are faced with the option solely of having all of this very, very important, very effective legislation all in one day?
Well, I thank the right honourable gentleman for notice of that point of order. He's a very experienced Member of Parliament and Minister. The government has put its proposals for the timetable in the business of the House motion. Government has come forward with that. It is for the House to decide whether or not it agrees with that motion. There is the opportunity for the House to disagree with the motion. That's the way it is working today. I am sure, I'm confident that the right honourable gentleman will have made his concerns clear to the government and many other people, the powers that be. The powers that be. That is how it works. The House has got the option to reject the motion if it doesn't like it. Point of order, John Barrett. I must say we do need to move.
Very briefly, just further to that last point of order, is there anything the Speaker can do with regards to extending the time that Parliament has to scrutinise this important legislation today? Because we are raising tens of billions of pounds for a social care reform of which Parliament has had no opportunity to scrutinise the details of. In fact, I'm not even sure the details have been supplied. That is the wrong way of going about business in this place, and it doesn't reflect well on us here.
Well, the right honourable gentleman could have put an amendment down to the business of the House motion and given the House different choices as to how long it wished to spend discussing the motion. As I say, as it is, it's in the hands of the House to decide whether it accepts
or otherwise the business of the House motion. I hope that's clear. Point of order, Jonathan Ashworth.
Can I just reinforce the point that the Right Honourable Member for Billericay has just made? If ministers are going to impose upon our constituents a punishing unfair tax rise, surely a health minister must come to the House and explain what that money is actually going to be spent on.
Well, that is obviously a point of view. It has been expressed previously, I think, from different parts of the House. However, it's not really a matter for the Chair. I'm sure that is something that may come up in debate. Having said that, I think we should now move on to the 10-minute rule motion. Mrs. Maria Miller.
Thank you, Madam Deputy Speaker, and I beg to move that leave be given to bring in a bill to restrict the use of non-disclosure agreements and for connected purposes. We have some of the best laws and regulations in the world to protect people from bullying and discrimination and abuse in the workplace. Yet we allow scurrilous employers to conceal unlawful wrongdoing through the use of non-disclosure agreements, effectively rendering legal protections we have voted for here in this chamber to be null and void. Many hundreds, perhaps thousands of people a year, people we represent, do not have access to proper protection at work because we're allowing employers, through their lawyers and HR professionals, to cover up wrongdoing through an apparently legitimate means, non-disclosure agreements. Now, Madam Deputy Speaker, let's be clear from the outset. Most employers value and invest in their staff, knowing they are their most important asset, and most employees never experience the sort of discrimination, bullying, and worse that non-disclosure agreements are being used to cover up. It's absolutely right that employees can be required not to divulge confidential information they have access to in the course of their employment, and almost every employment contract should and would contain such provisions. But that is not the same as a non-disclosure agreement which seeks to silence disclosure of wrongdoing experienced at work. Non-disclosure agreements were invented by lawyers to protect intellectual property, not to create an atmosphere of secrecy in the workplace. Now, the use of non-disclosure agreements is driving, I believe, the wrong culture in the British workplace, a culture where poor management can be covered up, a culture where the silence of employees who have experienced significant wrongdoing can effectively be purchased, even motivating a small number of employees to vexatiously seek payouts from employers by making spurious allegations. We simply have to break this damaging cycle, and my bill would do just that, because my bill would make it a basic principle of our legal system that no one, however powerful, can buy an employee's silence if there are allegations of wrongdoing in the workplace. Now, putting that into practice is not simple, and if an employer is willing to cover up even an unlawful behaviour with an NDA, then what is stopping them from putting pressure onto employees to withdraw allegations of wrongdoing in return for a payout, and an NDA never to divulge what has happened? There is a powerful argument to completely ban NDAs for this reason alone, but we need to look to the legal sector to see if there is a transparent way to resolve this tension. If not, then a ban would be the only option. At the moment, non-disclosure agreements are completely unregulated. They can and are being used to attempt to cover up even criminal allegations. They can even include unenforceable conditions included to scare employees away from seeking support or redress from the criminal justice system or indeed the employment tribunal system. My bill would change this, bringing in new laws to restrict the use of non-disclosure agreements to ensure employees can always enjoy the protection of the law as intended. One of the problems I know ministers, and I commend the work that my honourable friend, the minister on the front bench, is doing on this, because I know that ministers have faced over the past 4 years really significant problems in tackling this. Since the Me Too campaign started in 2017 and since the Women and Equality Select Committee published their report in 2019.
the scale of the problem has been very difficult for the government to get their hands around. There's no statistics published because people who have agreed to an NDA may feel that they can't tell a third party that they have undertaken such an agreement. And that's why I'm supporting the new campaign to be launched today by Zelda Perkins called Can't Buy My Silence, which will enable people who have had bad experience of NDAs to talk publicly about their experiences for the first time anonymously. Now, some people have expressed to me their concerns about those who have suffered wrongdoing and simply wanting to get out of a particular situation and get on with their lives. Now, there's nothing in this bill that would stop that happening. If an employee makes an allegation of wrongdoing, which an employer will not investigate and will not resolve, the employee can still accept an offer to leave an organisation in return for financial compensation. But the change would be that employers could not demand a non-disclosure agreement because it would be unlawful, and I think that that is an important step forward. Now, can I welcome the government's early indications in the Violence Against Women and Girls strategy published in July that they will be reviewing the use of NDAs in universities in cases of sexual harassment. But if NDAs are wrong when they're used to cover up sexual harassment of students, why not sexual harassment of mature students, members of university staff? Why not people who work in other types of organisations? Why not other sorts of harms? Because in acknowledging the harm caused by NDAs, as the government has done in the Vaughan strategy, I believe they have to act consistently and outlaw their use when there are allegations of wrongdoing elsewhere. The government already has their own evidence of the dreadful harms being caused to people's mental health through non-disclosure agreements, which came through in their own consultation of 2019. Now, there might be people listening to this debate today concerned that they've used non-disclosure at work, maybe even covering up wrongdoing. There may be some employment lawyers listening to this debate today who are concerned that they may face professional sanctions if the law were to change. Madam Deputy Speaker, these are really important issues we need to tackle because the profession, the legal profession, needs to resolve this and find a way forward. These fears cannot stop a long overdue clean-up of UK working practices. Legislation is already being considered and put in place in places like California, Canada, Ireland, and the list goes on. We cannot be left behind. We need to legislate for change, and we can no longer pretend this abuse of the law isn't happening. It is, and the government has evidence that it is too. Parliament has to legislate now if we want to ensure that everybody is protected equally at work under the law. Thank you, Madam Deputy Speaker.
The question is that the Right Honourable Lady have leave to bring in the bill. As many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it, the ayes have it. Who will prepare and bring in the bill?
Flick Drummond, Mary Robinson, Sarah Champion, Angela Crawley, Kevin Hollinrake, Joe Gideon, Andrea Ledson, Tulip Sadiq, Emma Lowell-Buck, Philip Davis, and myself, Madam Deputy Speaker.
Mrs. Maria Miller.
Non-disclosure agreements bill.
Second reading what day?
Friday the 18th of March 2022.
Friday the 18th of March 2022. Thank you. We now come to the motion relating to Health and Social Care Levy Bill. Business of the House. Minister to move.
I beg to move.
The question is, as on the order paper, John Barron.
Mr. Speaker, I'll keep my comments very brief because I know it's eating into time, and I won't be dividing the House on this issue for the same reason. But I do wish to reiterate concern that many of us have about the fact that we are today discussing, in haste I would suggest, a very important piece of legislation that's going to introduce a massive tax increase, a bigger tax increase than some budgets alone raise. And yet we do not have details of the social care reforms that are being proposed. It's not the way to go about business in this place. I mean, often, in my 20 years' experience in this place, when we have rushed through decisions, as we are doing today, given that this was only announced last week, it increases the chance of big mistakes being made. And even at this late stage, and I know the front bench is not listening, but even at this late stage, I would ask the front bench to give consideration to allowing more time to consider this important matter. Because if we don't know the detail of what's being proposed, how in heaven do we know how much money to raise for it?
It wasn't a point of order. It's a debate. If the honourable gentleman wishes to speak, he can speak, but that wasn't a point of order. Is he wishing to speak? Sir John Redwood.
Thank you, Madam Deputy Speaker. Well, I'd like to support my honourable friend. I too won't want to press it to a division and understand the government has a sense of urgency. But I think we need 3 debates, not 1. I think we need a debate about how 10 or 12 billion extra would make a big difference to the waiting list in the NHS, and I'd like to know what the plan is for that. I think we need a debate about how you transition the money from health to social care and what the social care plan looks like. And I think we need an economic policy debate about whether you do actually need to raise 12 billion in tax, and if so, if this is the right tax to do. And I would urge the government in their own interests to unpackage this, at least in their own remarks, to understand that we need to see the cases for these different propositions. And if I go to a shop, I don't present them with some money and then go away with them saying in a month's time I get a brochure about what I might have bought. I expect to get the goods. Call me old-fashioned, but I'd just like to see what the goods are going to be. Would I like my waiting list down? You bet. Would I like people in my constituency to have access to better public social care? You bet. But I want to know I'm going to get that, and then I want to know why they think they need a tax.
Dr. Andrew Morrison.
Madam Deputy Speaker, I think it's very clear to most of our constituents that after 18 months there will need to be a tax rise in order to pay for some of the service items that the NHS has not been able to do because it's been dealing with the pandemic. And I think there's also an expectation that we will be improving social care. And most people would say, well, that's going to come with a price tag. And it seems to me entirely reasonable for the government to say we'll publish a white paper in order to flesh out, after consultation, many of those things and some of the fine detail that my honourable and right honourable friend have just described. But I think we have to assume that it's going to come with a not insignificant price tag, and therefore it's perfectly reasonable for this government to put this bill before the House in order to anticipate the funds that will be necessary and will be a prerequisite for the kinds of things that we imagine are going to be fleshed out as part of the white paper. And there is some urgency in this.
The question is, as on the order paper, as many as are of that opinion say aye. Aye. The contrary, no. I think the ayes have it. The ayes have it. The clerk will now proceed to read the orders of the day.
Health and Social Care Levy Bill, second reading.
Now.
A reasoned amendment in the name of the Leader of the Opposition has been selected. Minister to move the second reading.
Thank you, Madam Deputy Speaker. I beg to move that the bill be now read a second time. Last week, the Prime Minister announced a plan to tackle the NHS backlog, put the adult social care system on a sustainable long-term footing, and end the situation in which those who need help in their old age risk losing everything to pay for it. The government's plan will make an extraordinary difference to the lives of millions of people across this country, and it will be funded with a record £36 billion investment in the NHS and social care. In order to pay for a significant increase in spending in a responsible and fair way, the bill before the House today introduces a new 1.25% health and social care levy based on national insurance contributions. Of course I give them.
Thank my right honourable friend for giving way. And we need to give due credit where it's due. The government is absolutely right to try to grasp this nettle, but many of us share the concern about the haste in which it's being done. Does my right honourable friend think it's a good idea to raise taxes on jobs ineffectively and risk choking off an economic recovery before we've even got to know the details when it comes to the social care reforms?
Well, Madam Deputy Speaker, my right honourable and good friend raises two connected points. The first, with respect to the chair, that was dealt with through points of order, that it is the will of the House in terms of the timings of debate, and the chair addressed that. The second, we obviously discussed at length in terms of the ways and means debate last week in terms of the wider purpose in dealing with the consequence of COVID, the backlog in care that needs to be tackled, but also grasping the nettle in terms of long-term challenges around social care, which are ones that the House has repeatedly debated over many years. Now, the levy, I'll just make a little progress and then of course I'll come back to him. The levy will apply UK-wide to taxpayers liable to Class 1 employee and employer, Class 1A, Class 1B and Class 4 self-employed NICs. However, it will not apply where taxpayers pay Class 2 NICs or Class 3 NICs. It will be introduced from April 2022, and then from April 2023, the levy will also apply to those working over the state pension age. And as my honourable and right honourable friends will understand, it takes time for Her Majesty's Revenue and Customs to prepare its systems for such a major shift, and that is why, as set out in Clause 5, in 2022-23, the levy will be delivered through a temporary increase in NICs rates of 1.25% for 1 year only. Of course, I give way.
Hypothecation is to be avoided, and what we should be doing